So today is all about bringing people together who care about end-of-life and palliative care services across North Cumbria so that we can join up more, support each other and most importantly get it right for our patients. So we've got people here from right across the system, through primary care, through hospitals, community teams, but we've also got our hospice services here, we've got the MND Association, we've got organ donation, everyone with an interest in being able to make sure that we wrap the right care around the patient and around the loved ones that are left behind.
So we're here today as part of the palliative care learning event. It's part of the protected learning time here in North Cumbria. It's fantastic to be here to be able to support this event from both the comms and media point of view and supporting with registrations and just have a presence here at the event. We have a variety of organisations here today. We have a variety of roundtable events happening, really interesting and informative discussions, really informative talks. So it's going to be great to see how the day goes.
It's brilliant to be here today and to have our new banners, which obviously have got Boost written on them. A lot of the people here today in North Cumbria will be familiar with CLIC, with the Cumbria Learning and Improvement Collaborative, and now it's really good that we're able to join up with the whole of the North East and North Cumbria. So we've come together as a big region, integrated care system to share our learning around health and care. So CLIC is now Boost, which is brilliant. We're not looking to solve things today, we're looking to say actually what does a good death look like, and actually where are our gaps in North Cumbria? How can we work together collectively to make things better in terms of palliative care and end of life for the people that we serve in North Cumbria. But obviously we can then share that learning across the whole system.
Oh, it's fantastic to be invited, and I've been doing quite a lot of listening to services around the country doing this same kind of, have we got the right bits, are the right bits in the right places, do they join up properly? And what's really impressive about this, first of all, is the massive turnout and the enthusiasm. We've got social care, we've got NHS, we've got community, we've got hospital, we've got third sector and charities and support organisations. It's absolutely brilliant, and it's wonderful to see that people really want to make this work.
I think today is a fantastic opportunity to bring all the system together, everybody who works in end-of-life care, who are doing an amazing job, but we've been through a really tough time. We've gone through the COVID-19 experience, which has just been really difficult for staff, and this is a chance to come back together. We know end-of-life care is really changing in terms of its need. We know by 2040 it's going to be up by 40%, so we have to respond to that as a system. And this is a fantastic opportunity to see where the gaps and how can we plug those gaps and work together as a system to do that. The big thing for me today is connecting, networking with everybody across the system and being motivated to do as much as we can for patients in our local community. We've got a wealth of information that's being shared today, and I think this is a perfect opportunity to use those networks and really get the best care we can for patients.
I think it's really important for the networking, especially for motor neurone disease, because it's such a rare disease, but the impact on people is huge, and when we get it wrong, it falls really wrong. So actually to be in a room full of people to network is really, really helpful to raise the awareness of motor neurone disease. It's a charity that started in 1947, so we've been running a long time now, but it's there to support people with information who are living with the disease, but also healthcare professionals in their work to give information to help them support those living with the condition as well. But importantly, we also support people who are suspected of having MND. And actually out in primary care, we do find that there's a lot of people who perhaps have symptoms, but it takes a long time before they actually get a diagnosis. Sometimes it can be up to 18 months. And during that time, people can change dramatically.
The project started in May 2022, and basically, as you can see, it's called Let's Talk About Bereavement, and it's actually a 2-year project, finishes at the end of January, and it provides free bereavement skills training. So there's 5 packages, 5 sessions. All 5 are open to anybody, with the idea of building normality into conversations about death, dying and bereavement. End-of-life care is an extremely important part, and you know, when you see it do well, it makes such a difference to the person who's dying as well as their family and everything. And obviously pre-bereavement and bereavement is all part of that, and the support of the families as well as the patient themselves. And if we want to get it right, we need to have these events so we can all who share that passion for getting it right all together in the same room to look at the solutions.
Today's a fantastic event because it brings everybody together, collaborative working,
bringing all different parts of the system together to talk about why it's important to have a good death and why it's important to put that advanced care planning in place. And for me, as personalised care project lead, it's so important to put that personalisation at the heart of that, and hopefully we can get that across today. My personal journey, I've seen what a good death looks like, and I've also seen what a bad death looks like, and I don't want that to happen to other people in this area. So for me, it's really important to put that across and get that personalised approach in there.
What has struck me is the energy in the room. There's been, the attendance has been overwhelming, and there were people on the waiting list to come to today. So it shows how important end-of-life care is considered right across all the different elements of healthcare and social care.
So what do I want people to take away? 3 things. So 1, I want people to feel a bit powered up and inspired, get their batteries recharged and really care about what we can do together for palliative care. I want them to network and meet people from different teams so that we can better work together, and then also get involved in how we can make the pathways the best they can be for patients so that we get it right. If everybody gets involved, we'll get there.